Hello everyone, welcome to Groups Master. This is UPSC Group 1 Mains Revision Series Science and Technology. వీడియోలో మనం టాపిక్స్ 8.0, 8.1 and 8.2 డిస్కస్ చేస్తున్నాం. మన ఈ వీడియోలో ఈ టాపిక్స్ అన్ని డిస్కస్ చేస్తున్నాం. ప్లీజ్ విజిట్ అవర్ అఫీషియల్ వెబ్సైట్ www.groupsmaster.com for further updates and information. Common infections and preventive measures. First of all, what are infectious diseases? Infectious diseases की definition ఈ విధంగా ఇవ్వచ్చు. Infectious diseases are illnesses caused by harmful agents, also called pathogens, that get into human body. The most common causes are viruses, bacteria, fungi and parasites. These infectious diseases usually spread from one person to another person through skin contact or through contaminated food or water or through bug bites. The most common types of infections are bacterial infections, viral infections, fungal infections and protozoa infections. Next, viral infections. Viral infections occur due to infection with a virus. Virus అనేది ఒక tiny germ. It lives inside the living cells or host cells. Viruses are unicellular organisms that are made up of a core of genetic material, either DNA or RNA. It is surrounded by protective coat made up of protein. Viruses need a living cells. వాటికి living cells కావాలి in order to reproduce or replicate. Viral infections examples ఏంటంటే COVID-19, SARS, influenza flu, common cold, AIDS, pneumonia, Ebola. ఇవన్నీ కూడా వైరల్ ఇన్ఫెక్షన్స్ ఎగ్జాంపుల్స్. వైరల్ ఇన్ఫెక్షన్స్ కెన్ బి ట్రీటెడ్ విత్ యాంటీవైరల్ మెడికేషన్స్ విచ్ యూజువల్లీ స్టాప్ ఎ వైరస్ ఫ్రమ్ మేకింగ్ కాపీస్ ఆఫ్ ఇట్ సెల్ఫ్. నెక్స్ట్, బ్యాక్టీరియల్ ఇన్ఫెక్షన్స్. Bacteria are single cell microorganisms that thrive in many different types of environments from extreme heat to intense cold. Some bacteria lives inside the human body without causing a harm. కొన్ని బ్యాక్టీరియా బెనిఫిషియల్ బ్యాక్టీరియా కూడా ఉంటుంది, అలాగే హార్మ్ఫుల్ బ్యాక్టీరియా కూడా ఉంటుంది ఇన్సైడ్ ద హ్యూమన్ బాడీ. స్ట్రెప్ థ్రోట్, కలారా, డిప్థీరియా, టీబీ, typhoid, urinary tract infections are the examples of bacterial infections. These bacterial infections can be treated with antibiotics. However, but some strains become resistant and can survive the treatment. Protozoa infections. Protozoa are microscopic single-celled organisms that can live independently as a free-living organisms in the environment or parasitic in nature. They are often found in soil, water or moss. Some protozoa are parasites. Some protozoa live in symbiosis with other organisms for their survival. Protozoa can multiply in humans and transmit from one person to another. Common infections or diseases that caused by protozoa are malaria, giardiasis, amoebiasis, toxoplasmosis, pinkworm infection. ఇవి protozoa infections కి examples. ట్రీట్మెంట్ ఆప్షన్స్ ఏంటుంటాయంటే ద ట్రీట్మెంట్ ఆప్షన్స్ డిపెండ్స్ ఆన్ వాట్ ప్రోటోజోవా ఆర్ ఇన్ఫెక్టింగ్ ద పర్సన్. ఏ ప్రోటోజోవా పర్సన్ ఇన్ఫెక్ట్ చేసిందో దాని మీద బేస్ చేసుకొని ట్రీట్మెంట్ అనేది స్టార్ట్ చేస్తారు. ప్రోటోజోవా డిసీజెస్ డయాగ్నోసిస్ త్రూ బ్లడ్ టెస్ట్, స్టూల్ టెస్ట్ అండ్ బయాప్సిస్. నెక్స్ట్, ఫంగల్ ఇన్ఫెక్షన్స్. Fungal infections are skin diseases caused by fungi. Fungal infection is also called mycosis. Fungal skin infection might cause irritation, skin redness, itching, blisters. Common fungal infections ఏంటంటే athlete's foot, ringworm and yeast infections. Fungal infections can be treated with antifungal medications specific to the particular fungus that caused the infection. Antifungal medication can be applied topically. Topically అంటే used on the outside of the body, like cream apply చేస్తాం కదా అలాగా, or taken orally like tablets. Next, how to prevent infections. The best way to prevent infections is to block pathogens from entering the human body. Next, by following the good personal hygiene habits such as wash your hands well, taking a bath and keep germs at bay. Avoid sharing personal items like toothbrushes, towels, razors and handkerchiefs. Cover your mouth when you cough or sneeze. Next, wearing face masks can help you avoid getting an infectious respiratory disease, prevent you from infecting others if you are infected. Receive any recommended vaccinations. Only take antibiotics with a prescription and be sure to complete the recommended course. Then use safe cooking practices. ఇవన్నీ కూడా హౌ టు ప్రివెంట్ ఇన్ఫెక్షన్స్లో ఈ పాయింట్స్ అన్ని మెన్షన్ చేయొచ్చు. నెక్స్ట్, కొన్ని డిసీజెస్ని ఇన్ఫెక్షన్స్ డిసీజెస్ని మెన్షన్ చేశారు ఏపీఎస్సి. అందులో మనం మెన్షన్ చేసిన అన్ని డిసీజెస్ని కూడా ఇప్పుడు మనం చూస్తున్నాం. నెక్స్ట్, డయేరియా. వెన్ ఎ పర్సన్ హ్యావ్ లూజ్ ఆర్ వాటరీ స్టూల్, ఇట్ ఈస్ కాల్డ్ డయేరియా. Causes of diarrhea: it is caused by eating food or drinking water contaminated with bacteria, viruses or parasites. Next, viral gastroenteritis is the most common cause of the acute diarrhea. Next cause is eating foods that upset the digestive system. Malabsorption of food is also the cause of diarrhea. Long term use of medicines can cause chronic diarrhea. ఇవన్నీ కూడా causes of diarrhea లో రాయాల్సి వస్తుంది. నెక్స్ట్, సిమ్టమ్స్ ఏంటంటే డయేరియాకి అర్జెంట్ నీడ్ టు హ్యావ్ ఎ బౌల్ మూమెంట్. నెక్స్ట్, డిహైడ్రేషన్, నాషియా, వామిటింగ్. ఇవన్నీ కూడా డైరెక్ట్ సిమ్టమ్స్. Next, how to treat diarrhea. Most diarrhea is mild, clears up in a few days without a treatment. Sometimes very severe cases, for most of the severe cases, persons need to admit in the hospital. The mild diarrhea can be treated with supportive therapy, staying hydrated, ఎక్కువ వాటర్ తాగుతూ ఉండాలి. అలాగే bland diet అంటే that foods that are soft and not very spicy and low in fiber. Avoid fruit juice, cordials and sugary drinks because they will prolong the diarrhea. ఈ విధంగా diarrhea treat చేయొచ్చు. Next, how to prevent diarrhea. Wash hands frequently, follow proper food safety practices. Children can be vaccinated against rotavirus. Diarrhea can spread by contact with another person who has the illness. Dysentery. Next, dysentery. Dysentery is inflammation or infection of the intestines. Intestines ko vachina infection ni dysentery antam, which results in diarrhea containing blood or mucus. Two types of dysentery: bacillary dysentery and amoebic dysentery. Bacillary dysentery is caused by bacteria called Shigella. Amoebiasis or amoebic dysentery is caused by amoeba called Entamoeba histolytica. Symptoms ఏంటంటే stomach cramps, nausea, vomiting and fever. Next, what are the causes of dysentery? It can occur due to bacterial or parasitic infection, poor hygiene or sanitation, consumed improperly stored food, swallowing lake or river water when swimming. ఈ విధంగా అమీబా బాడీలోకి ఎంటర్ అయ్యే అవకాశం ఉంది ఈ కాజులు. నెక్స్ట్, ట్రీట్మెంట్ ఏంటంటే యాంటీబయాటిక్స్ అండ్ యాంటీపారాసైటిక్స్ ఆర్ యూజ్డ్ టు ట్రీట్ dysentery. Drink fluids to avoid dehydration and also follow good hygiene methods to control its spread. Next, how to prevent dysentery? By washing your hands properly after using the toilet. Avoid uncooked and unhygienic food. Do not use unhygienic toilets and also avoid sharing towels and other personal care items. Next disease is cholera. Cholera is a bacterial disease usually spread to contaminated water. It causes severe diarrhea and dehydration. Cholera is caused by infection of the intestine with Vibrio cholerae bacteria. It is caused by ingestion of contaminated water or food, raw or undercooked shellfish and seafood. Next, what are the symptoms of cholera? Ante diarrhea and dehydration, nausea and vomiting, muscle cramps. Next, cholera treatment ఏంటంటే there is a vaccine for cholera, but there are specific guidelines for who should be given this vaccine. Stay hydrated and take electrolyte solutions to replace lost fluids. Antibiotics are used to treat severe cases. ఈ విధంగా cholera treatment ఇవ్వచ్చు. Next, what are the preventive measures అంటే choleraకి? Wash your hands with soap after using toilets. Drink only safe water and avoid using contaminated water. Avoid eating unpeeled fruits and vegetables. Oral vaccines are necessary for those who are traveling to areas affected by cholera. Next, tuberculosis. TB is a bacterial infection that mainly affects the lungs. TB bacteria spread through the air from one person to another through inhaling tiny droplets from the coughs or sneezes of an infected person. Next, types of tuberculosis. There are two categories of TB. One is pulmonary TB, which mainly affects the lungs, and the one is extrapulmonary TB that mainly affects both the lungs and other organs. Miliary tuberculosis and TB meningitis are the two serious forms of TB. Miliary TB affects the whole body, while TB meningitis affects the central nervous system. TB causes ఏంటంటే it is caused by a type of bacteria called Mycobacterium tuberculosis. TB bacteria spreads when an infected person coughs or sneezes. One can get TB only if they come into contact with the people who have TB. What are the symptoms of TB? And a cough that lasts more than 3 weeks, fever, chest pain, coughing up blood, weight loss and loss of appetite. These are the symptoms of the tuberculosis. Next, how to treat TB? And antibiotics are used for the treatment of TB. However, the bacteria has been known to become resistant to antibiotics and it became a global concern nowadays. For active TB, one must take antibiotics for at least 6 to 9 months. Bacillus calmette guerin BCG అనే vaccine అంటాం. It is a vaccine that generally used for the TB disease. It provides moderate protection against severe forms of TB in infants and young children. There is no effective vaccine to prevent TB disease in adults. The preventive measures are early diagnosis and treatment is the most effective way to prevent the spread of TB. TB can be spread when a person with active TB disease releases germs into the air through coughing or sneezing. So to prevent TB spread, TB infected persons should stay away from work, school or college until it's safe to return. Cover the mouth when you cough. Avoid close contact with TB infected people. Having a healthy immune system is the best form of defense against TB. Next, infectious diseases. Malaria. Malaria is a serial tropical disease spread by mosquitoes. It can be fatal if not diagnosed and treated quickly. Causes ఏంటంటే it is caused by the Plasmodium parasite. This parasite is spread to humans through the bites of an infected mosquitoes. What are the symptoms of malaria? And high fever and headache, sweats, chills, muscle pains and vomiting. Next, treatment. Early diagnosis and complete treatment is most effective for the malaria. Treatment with tablets depends on the type of malaria and severity of the symptoms. Next, prevention. awareness about risk of getting infection while traveling in malaria endemic areas, and use insect repellent and cover skin with clothing. Use a mosquito net to avoid mosquito bites. Taking immediate medical advice if one have malarial symptoms. Next is HIV, human immunodeficiency virus. It is a virus that affects the body's immune system. If HIV is not treated, it can lead to AIDS. AIDS and acquired immunodeficiency syndrome antam. HIV makes person more vulnerable to other infections and diseases because your immune system is compromised here. Causes: it is transmitted. HIV is transmitted through bodily fluids like blood, semen and breast milk. HIV can spread through sexual contact, use of sharing needles, contact with infected blood, or from mother to child during pregnancy and breastfeeding. These are the causes of HIV. Next, what are the symptoms of HIV ante? Fevers and chills, night sweats, muscle aches, rashes and sore throat. Treatment ఏంటంటే there is currently no effective cure to treat HIV, but many treatment options are available which can slow the progress of HIV significantly. With antiretroviral therapy, it is possible to manage HIV and to increase the life expectancy of the patients. Next, HIV prevention. HIV can be transmitted only in certain bodily fluids, that is blood, semen and breast milk, from a person who has HIV. So avoid sharing needles, syringes and other injecting medical equipment is one of the preventive measures. Take right treatment to reduce the chance of passing HIV to the baby during pregnancy, childbirth and breastfeeding. Using condoms during sex reduces the risk of getting HIV. These are the HIV preventive measures. Next infectious disease is encephalitis. Encephalitis is an inflammation of the brain that can be caused by a variety of factors including viral infections, bacterial infections and autoimmune disorders. The types of encephalitis ante Japanese encephalitis, tick-borne encephalitis, primary encephalitis and secondary encephalitis. These are the types of encephalitis. Japanese encephalitis is caused by flav virus, which is transmitted from the bite of a Culex mosquito. Next is tick-borne encephalitis. It is a viral infection that affects the central nervous system of a human body. It is caused by tick-borne encephalitis virus. Primary encephalitis occurs when a virus directly infects the brain and the spinal cord. Secondary encephalitis occurs when an infection starts elsewhere in the body and then travels to the brain. Here, immune system of human body starts attacking the healthy cells of the brain. These are the types of encephalitis. What are the symptoms of encephalitis? And fever, headache, joint pain, muscle weakness, confusion and seizures. Next, causes of encephalitis. Encephalitis is caused by viral, bacterial or a fungus infection to the brain. Sometimes immune system of the body might also mistakenly attack the brain tissue. However, in many cases, the causes remain unknown for the encephalitis. Herpes simplex type 1 virus is one of the more common and serious cause of viral encephalitis. Infections like rubella, mumps, measles causes secondary encephalitis. It can also be caused by bacterial infections such as bacterial meningitis. Next, treatment. Antiviral medications to fight viral infections affecting the brain. Next, treatment options. Bacterial encephalitis is treated with antibiotics. In some cases, corticosteroids may be used to reduce the inflammation in the brain. Immunotherapy or plasma exchange can address certain types of autoimmune encephalitis. Medications or other therapies to control seizures. Intravenous fluids are given to prevent dehydration. These are the treatment options available for encephalitis. Next, preventive measures. Vaccination. Vaccines are available for several viruses that can cause encephalitis such as measles, mumps, rubella. వీటికి వ్యాక్సినేషన్స్ ఉన్నాయి కనుక వ్యాక్సిన్ తీసుకుంటే encephalitisని reduce చేయొచ్చు. Next, practice good hygiene. Washing your hands frequently can also help to prevent spread of infection. Using mosquito repellent and mosquito nets can help to prevent mosquito bites. Being aware of the symptoms help you to seek medical attention early. If you suspect you may have the condition. Next one is Chikungunya. Chikungunya is a mosquito-borne viral disease caused by the Chikungunya virus, Chikungunya antam, which is an RNA virus. It is transmitted to humans through bites of mosquitoes infected with the Chikungunya virus. It is transmitted to humans by Aedes mosquito. Chikungunya is not transmitted from one person to another. The virus needs a vector, that is here in our case is mosquitoes. Next, symptoms of Chikungunya are fever, joint pain, headache, muscle pain, swelling around the joints and rashes. Next, treatment. The treatment includes addressing the fever and joint pain. Paracetamol is generally recommended initially for pain relief and reducing the fever. Drinking lots of fuels and taking rest might help. There are no vaccines for Chikungunya, remember, and also there is no specific antiviral drug treatment for Chikungunya. Next, prevention. The best way to prevent chikungunya infection is to avoid mosquito bites. Using mosquito repellent and mosquito nets can help to prevent mosquito bites. Chikungunya transmission can be prevented through control of mosquito vectors. Eliminate mosquito breeding sites. During outbreaks, insecticides may be sprayed to kill flying adult mosquitoes. Next common infectious disease is bird flu. Bird flu or avian influenza is an infectious type A influenza virus that spreads among birds. Water birds such as wild ducks are believed to be the carriers of all avian influenza type A viruses. Only influenza A viruses cause flu in birds. Bird flu can also infect humans and other animals. Remember this point. Bird flu is transmitted to humans when the virus travels from the saliva, mucus or droppings of an infected bird into person's eyes, nose or mouth. ఈ విధంగా హ్యూమన్కి ట్రాన్స్మిట్ అయ్యే అవకాశం ఉందన్నమాట బర్డ్ ఫ్లూ. What are the symptoms of bird flu? అంటే symptoms in birds differ according to the species but can include diarrhea, breathing difficulties, swollen head and death. A sick bird sheds the virus in its feathers, mucus, saliva and fecus. Symptoms of bird flu in humans includes very high temperature, headache, muscle pain, cough or shortness of breath. Next, what are the causes of bird flu? Bird flu is caused by influenza A viruses that primarily circulate among wild birds and poultry. Bird flu is spread through contact with both wild birds and domestic poultry such as chickens, turkey and ducks. Avian influenza viruses do not usually infect people. H5N1 and H7N9 infections are responsible for most human illness worldwide to date. What are the treatment options for bird flu? There is no specific treatment for bird flu in humans and most people recover on their own. Bird flu is treated with antiviral medication sometimes to reduce the risk of complications. Next, prevention. Surveillance and early detection of the virus are most important to contain the spread of bird flu. The greatest risk for people who work with poultry. So after handling poultry and eggs, they must wash hands and other exposed parts with soap and water. Avoid contact with sick birds. Avoid consuming uncooked or partially cooked poultry products such as chickens and eggs. Control the spread of the virus among domestic poultry by isolating the infected birds and by culling infected birds. Properly clean and disinfect the poultry farms and equipment. These are the preventive measures for bird flu. Thank you very much. If you really like this video, please subscribe to our Groups Master YouTube channel. Thank you.